So we have done all the attachment, and this is doing a final curing, and Sherman is doing well. Alright, going through all the teeth. He's going to embark on the 2-year journey to have his teeth straightened, and hopefully he's going to be at least 5 years younger. Look at least 5 years younger at the end of the treatment. There you go, one by one. We're getting there.
I just wanted to show you guys how my teeth look like before I do braces. So hopefully you guys can see this. Not straight at bottom, and this one inside. And wow, it's light bright enough. And you can see there's another tooth in there. Alright, it has grown further in and hasn't come out. But it came out, it's just that it's behind the other teeth. As you can see here. So when I smile, this happens.
Transparent ones here.
Okay, anything or not?
The colors are.
You can choose one. You can use transparent also. Okay.
Oh,
Yeah.
then it's just transparent. It can be like.
Yep. This one I put this first lah. Next week if you want to still want to feel you want to change this one, you can go still change lah actually.
Okay.
Put down stage here, okay?
Yeah, I think just now I forgot to switch on the.
Oh really?
just I'm
Really?
Oh, done.
Really?
Oh.
Use this to record your this thing
Huh? Oh.
You know, I actually want to vlog it.
Huh?
So I might put it on YouTube.
You want log in?
Vlog. Video logging.
Oh,
Yeah.
okay.
That's interesting. Alright, thanks doctor.
I ask you one.
As you can see here, right, I'm gonna have a look in the mirror here. So here you can see rubber bands put in my teeth, the lower one and the upper one. So there are 4 rubber bands, I think. So what the dentist said is that it will actually give me more space in my teeth and move it. You can see my teeth here, and the spaces. One of them has dropped out the bottom, and 2 at the top have already dropped out. So according to the dentist, the most painful part of the brace is actually the time when you put on the spaces. So these spaces have been on for me for about 2 weeks now, and today the actual braces, which are the metal, the steel one, the stainless steel braces, will be put onto my teeth. And before that, the spaces, what they do is they clear the space, or they add space in between, as you can see here, 2 teeth below and 2 teeth above. And I think what the dentist will do is add the sort of like pillars there for foundation for the stainless steel braces. And as you can see, my teeth are still not straight. Hopefully after I put the braces on, it'll be straight. Okay, I'm halfway through with the process. That's Dr. Sia and the keep nurses here. You can see here I've done the top part. There you go. And this shave here, so it's a bit shorter, the tooth. But other than that, the bottom part has not been done yet. The top part has all this there. Is it painful? Not really, just some slight pain, and there was this sourish taste. I don't know what that was, but it was really sour. Couldn't stand it.
Lemon juice.
Lemon juice.
The citrus. Yeah. Okay, now we're going for second half.
Okay.
Alright, let's go.
Okay.
Okay. Looks better. Good.
Okay.
Fantastic. Okay, retract that in please.
Alright, that one. Next again.
Turn to the right side again. Turn to the right side. Alright. I need to close a bit. Try not to get the lips to touch the teeth now. Don't open too wide. Just a little bit close. Close a little bit. Yeah, thank you. Alright. Let's do it. Okay, got this.
354 yan.
Got this.
354 yan.
Okay. Next.
4.5.
Got this.
Okay. 4.
So we have done all the attachment, and this is doing a final curing, and Sherman is doing well. Alright, going through all the teeth. He is going to embark on the 2-year journey to have his teeth straightened, and hopefully he's going to be at least 5 years younger. Look at least 5 years younger at the end of the treatment. There you go, one by one. We're getting there.
All the braces done here, you can see here. As showing just now, there's the upper part, the lower part, and then he added the wires. So they're supposed to pull the teeth into position. See that? And there are also that little stoppers to prevent me from closing my mouth, so that teeth, the upper one, you can see here, that's inside can come out, because the dentist, Dr. Sia, doesn't want me to bite on that tooth that's hidden inside. So when it's not bitten down on, the tooth can slowly move out and feel that gap over there. I have this bite control here that's on. See that plastic thing? It is to prevent my upper teeth, the upper set of teeth, from biting the lower teeth, so that this tooth, as you can see, there's a tooth that was inside before, now is able to come out and it's all straight now, right? The teeth, I don't have any tooth that's hidden inside anymore. So that's really cool. And today is the November 23rd, so I started in the end of March. It's about 9 months now, and I guess my teeth are looking much better. So when the dentist removes the bite control mechanism here, he will be able to put the wire again and to straighten my bottom set of teeth, which he has not done, because he said that it'd be good if I get the upper tooth to come out first. It has been a year since I started my braces treatment, and as you can see, my teeth are pretty straight right now, upper and lower. So the upper set of teeth, I had one tooth going right in here. See this one? Yeah, it was previously inside, and the dentist, Dr. Sia, has managed to pull it out completely. See, it's almost completely straight. And at the bottom tooth, the bottom teeth had a lot of overlapping, but now it's almost all straight. I just came back from the dentist. Dr. Sia was a really good dentist. He managed to shave off some of the tooth on the bottom front tooth here, as you can see, this tooth, and now it's almost completely in and straight, right? You can see there's slight overlapping still, but he said in 2 months it should be all in. So he has been seeing me every month to adjust my teeth, and only in the last 2 months he asked me to come back in 2 months. So I just been there and everything is almost straight. So he says wait another 2 months to see him again, and after that he will see me more often to adjust my teeth on a granular level to make them look really perfect. But so far so good. As you can see, it's all really nicely going into place. So most of you been asking me, is it a painful process? I'll answer you again. It's not an acute pain. There was no extraction or removal of any tooth at all. So Dr. Xiao was really good at that. He managed to do it without any extraction. So the only pain I felt was the you would say some slight pressure when Dr. Xiao was doing the adjustments on my teeth. So every time he does that, there is a slight pressure pain, but it's not acute. It's just like you feel a lot of pressure, and after that, for 1 or 2 days, you'll feel some slight constant pain, but that kind of pain is not acute. It's more like when you eat an ice cream, that kind of funny cold feeling, you get that. It only lasts about 2 days and then goes away. And then after that, there would be some pressure on the not pressure, sorry, there's some poking from the wires, but you can like push them in, and then it will be fine, it'll be gone. You just use your finger to push the wires in, because sometimes it just, when the teeth move, the wires come out a bit, so you just push them in so they don't poke you. And the wires are not really sharp, so it's fine, it's just annoying, so you just push them in. Then besides that, I think it's perfectly okay, and it's a really good decision for me, at least, to have done these braces. As you can see now, my teeth are so much straighter compared to when I first started. Bottom row, top row. Hey guys, it has been a year and a half since I started wearing my braces, and my first visit to Dr. Xiao, the dentist. So right now, my teeth are almost aligned. As you can see here, the bottom part is all done, and the top part, there's only one tooth that's slightly misaligned. Alright, so all Dr. Sia has to do is just move the braces here, the connection here, to move the alignment a bit, right? And once it's aligned, then hopefully everything will be done. So it's supposed to take 2 years. Now it's been a year and a half, so that's about right. The bottom set of teeth are almost, I think they are all aligned already. I think to me it's just perfect. You can see the rubber bands now. The rubber bands are to connect the upper teeth to the bottom teeth, and they are meant for alignment so that I can bite properly, so that my upper teeth will connect to my lower teeth when I'm chewing. And that's how it looks. This is how you put a band, rubber band here, and you hook it. There's a hook here, right? You can see that, a hook, and then you pull it, and then you join it to this hook out here. This is like a van hook there. So once you do that, you just change that like every you have to change that 3 times a day, right? So I'm gonna keep you guys updated on what happens next. It's just half a year more, and hopefully everything is done. My teeth are straight. And when my braces treatment started in March 2017 to now, it has been almost 2 years, and I hope to be able to remove them today. In fact, the dentist said they'll be able to remove my braces today. So as you can see, I'm having a bit of a rash here, and yep. So it's kind of been able to come down now, and everything is straight. So he'll remove my braces today. It's April 2020, and it has been more than a year since my last video, which was filmed in February 2019. That was when my dentist removed my braces, and I started the whole braces treatment in March 2017. So that was 2 years for the whole braces treatment process, from March 2017 to February 2019. And then it has been a year since I just wanted to create a video now, because there's a lockdown in Malaysia, and I finally can sit down and compile the video. I don't like editing my videos. I like to be spontaneous and just do videos in one go without editing, because that inspires me to keep creating videos. But now I had the chance to actually sit down and compile this video for you guys, and I wanted to show you guys how my teeth look like right now. What I'm gonna do is shine some light here. There we go. So completely straight now, and I have to wear retainers. So the retainers look like this. My dentist have given me this. I go and see my dentist, Dr. Sia, every 6 months now, and one time it broke. So that was like the first 6 months it broke. The bottom one broke, so he had to make me a new one. So be very careful with this. You have to wear this every day for at least 6 hours. So you can wear it when you go to sleep. Right, down here, and then put it up here. There you go. You can't even see them. So these are actually like Invisalign, they call it Invisalign braces, or the invisible braces, and they can actually move your teeth to the right place. Right now, this new technology will allow you to move your teeth without putting all those metal stuff, but they're really expensive, and they do not work for really extreme cases like my case, which had that teeth here, right here, which was inside before, and now it was pulled out with that braces. And Dr. Sia did a really excellent job with it. I suggest you visit him if you want to get your braces done in Malaysia. It's Uptown Dental in Uptown Damansara. Of course, not now because of the lockdown. He has a new dental clinic, and it looks really nice, like a hotel on the ground floor now. Previously it was on the top floor, and he moved to the ground floor. Well, thanks to my contribution as well, I guess. But yeah, really worth it, because he did a really good job. After a year, I just have to go see him every 6 months. Just
Keep in mind that you always have to wear retainers no matter which dentist you see, because the teeth are alive and they tend to move in your gums and they move out of alignment. So you have to wear these retainers to keep them in place. So I hope what I've gone through, my entire journey of having these braces on, will help you decide on whether to put braces for yourself as well or not. And if you like this channel, please do give me a thumbs up, subscribe, and I'll see you in more videos. Bye now. Thank you.